Hello everyone, welcome back to Spine Focus. If you're watching this video, there's a very good chance that your son or daughter has been advised scoliosis correction surgery. It's quite natural to feel stressed about surgery during this time. As a spine surgeon, I have come across a lot of patients and parents facing this decision, and they often come up with the same set of questions. Doctor, is the surgery really necessary? Can we do without it? What are the risks involved with the surgery? Will my child be okay after surgery? Will she lead a normal life? Can she go back to school? In this video, I will explain everything that a parent needs to know before scoliosis surgery. My goal is to make you understand the journey so that you can make an informed decision with confidence. One of the biggest misconceptions about scoliosis correction surgery is that the surgery is done for a cosmetic purpose to improve the external appearance of the patient. Well, that is not true. All the children with scoliosis do not require surgical correction. If the scoliosis is detected quite early, when the deformity is not quite severe, say for example 20 to 30 degrees, it can be managed without surgery using braces and serial follow-ups with x-rays. If the curve is less than 40 degrees, then the studies have shown that they do not progress once the growth spurt is over. However, if the curve progresses beyond 40 degrees, there is evidence to show that the spinal curvature will continue to increase at a rate about 1 degree per year, even after the growth is complete. So if we fail to operate curves which go beyond 40 to 50 degrees, it is highly likely that as a child grows older, the curve would increase in size. Now the problem is correcting a curve which is 40 to 50 degrees is much more easier than correcting a curve when it is more than 80 to 90 degrees. Also, as a spine continues to progressively get deformed, there is a high likelihood that the patient can suffer from back pain and can affect his quality of life. Also, as the deformity progresses, the shoulder levels becomes uneven. The prominence at the back of the ribs on one side becomes much more pronounced, and there's a high likelihood that the balance of the spine gets lost. For children who are in their adolescence, this could significantly affect their self-confidence and self-esteem. The spine is made up of bones called vertebrae. These vertebrae are not only tilted to one side in scoliosis but also rotated. For scoliosis correction surgery, we put specialized screws called as pedicle screws into selected vertebrae. These screws are connected using specialized rods. These rods allow the surgeons to gradually correct the deformity and bring the spinal balance back. The operated segments fuse with time, and which helps to maintain the surgical correction. The goal of the surgery is not to get a straight spine, but the idea is to get a balanced spine, preventing the progression of the deformity as a child ages. This helps in significantly improving the appearance of the child. A battery of tests are required prior to surgical correction. The anesthesia doctors would evaluate your child to make sure the child is fit to undergo a surgical procedure. Like any surgery, you will need to undergo preoperative blood tests, x-rays, pulmonary function tests or chest function tests. The child will also need to be evaluated by a pediatric cardiologist and a pediatric chest doctor to make sure that the child can safely undergo the scoliosis correction surgery. Whatever said and done, scoliosis surgery is a major surgical procedure. So like any major surgery, scoliosis correction surgery also carries risks. Risks include infection, chance of bleeding, problems related to the metalwork that we put in, wound-related issues, neurological problems. Parents are especially worried about the possibility of paralysis or weakness in the legs after the surgery. Neurological risk is a recognized risk of scoliosis correction surgery. Because we put implants or screws very close to the spinal cord and the nerves, there is a chance of injuring the spinal cord and the nerves. Also, because the correction involves straightening the spine, Along with straightening of the bones, the spinal cord, or the nerves which pass through the spine, also get stretched, which can also result in injury to the spinal cord, causing weakness in the legs. Fortunately, the risk of having a permanent neurological deficit or a weakness in the legs after scoliosis correction surgery is less than 1%. With the modern instrumentation techniques, with the advances in the imaging techniques that we have, robotics, navigation, the use of neuromonitoring technology, which continuously monitors the nerve function throughout the surgical procedure, the risks are significantly reduced with modern spinal surgery. Yes, there are risks. We take these risks seriously. An enormous amount of planning and teamwork goes behind every successful and safe scoliosis correction surgery. Most of the times, children worry about the pain that they will have to go through after the surgery, the scar that they will have, the number of days that they lose from their school schedule, whether their appearance would change completely after the surgery. One of the most important things that parents could do is to talk to the children openly and frankly, explain to them that the surgery is a significant procedure in their life and it has got its own challenges, but let them know that we will all be there to support them throughout the journey.